The body, the ramus, and the angle of the mandible can be augmented with alloplastic implants. This is done to increase the width of the lower third of the face, to increase its angularity, and to generally augment a hypoplastic mandible. The surgery is performed through an intraoral incision high on the labial side of the sulcus. This placement allows a watertight closure and prevents pooling of saliva in the postoperative period and subsequent contamination of the implant. The Medpore porous polyethylene implant is placed through the wide subperiosteal exposure created. The implant is subsequently fixed with titanium screws. The titanium screws immobilize the implant to prevent movement in the postoperative period. They allow in-place contouring of the implant, and perhaps most importantly, they obliterate any dead space between the implant and the native mandible. Any gaps between the mandible and the implant are ultimately read as unwanted increases in augmentation. The diagram shows that, on the left, the posterior surface of the implant is not congruent with the anterior surface of the mandible. The superior screw obliterates the gap and makes the implant reflect the contour of the mandible in this area. The second screw obliterates all gaps. Now the implant reflects the contour of the mandible. The increase in the augmentation is only that of the implant. A two-layer closure is performed, bringing first the buccinators muscle together and then the mucosa to provide a watertight seal. This patient underwent augmentation of his mandibular angle body and ramus. A hypoplastic mandible, perhaps a patient who had orthodontics treatment and a Class II malocclusion, can be brought into normal contour by augmenting both the angle and the chin.